Okay, welcome friends again to the another session, and today we will discuss about the routes of drugs administration, and I will try to look about the advantages and the disadvantages of each route that we will discuss. Firstly, the routes of drug administration are grouped into several groups, and mostly we group them into three groups, by which we have the enteral route, we have the parenteral route, and the topical route. By starting with the group of the enteral route, the word enteral means gastrointestinal tract, and therefore we will try to look about the GIT system and its application on the administration of drugs. We have the oral route, sublingual route, buccal route, and the rectal route. Let's start by looking oral route. The oral route, the advantages of the oral route: it is the safest and the most common way of drug administration. As we know, on our daily ways of taking drugs, we use most of these routes because it's the safest one, and it's so convenient and an economical route of administration. But this route had some of the disadvantages, in which there is limited absorption of some drugs. You know, for the drugs to reach the systemic circulation after administration, it should be absorbed. So you will see that about there will be some factors that hinder absorption of drugs that are taken through oral route. We know that if the drug is taken orally, it will reach the stomach and then it goes to the other parts of the GIT. While traveling through that GIT system, it will be absorbed in different parts, but you will see that different parts of the gastrointestinal tract differ in the terms of pH. So the pH will limit the absorption of some drugs. For example, let's say for the basic drugs that completely ionize, if you take them orally, it will completely ionize when it reach on the stomach, and there will be no absorption. So pH will be the limitation of one of the limitation for the absorption of some drugs. And also food may affect absorption. Here there are some drugs, if we take them with food, will be absorbed faster, and there are some drugs if you take with food, the absorption will be inhibited. For example, let's say for the aru, the drug for malaria that we used to take when someone is sick for malaria, if you take with fatty food, the absorption will be so fast. Also, another is that drugs may be metabolized before the systemic absorption. You know, when the drugs move along the gastrointestinal system, it will be highly metabolized before the systemic absorption. Before it's absorbed to go into systemic circulation, you may find out that the drug is highly metabolized. So even the amount of the drug that will reach the systemic circulation will be so low. So this is one of the disadvantages. Okay, guys. So on how to solve this problem of the oral route of drug administration due to the disadvantage, we use another route that is called sublingual route, sublingual route. Why we use this one? Let's look about the advantages of the sublingual route. One of the advantages that is to bypass the first pass effect. What is first pass effect? This is effect or metabolism by which when the drug first passes through the liver, the liver will metabolize the drug by either breaking it down by oxidation, let's say by for those which are lipid soluble drugs. When reaching to the liver will be degraded by oxidation, and also will bypass the first pass effect, because on sublingual route the drug will not pass into the stomach or along the GIT system, but it will go direct to the systemic circulation. And another advantage is that it bypasses the destruction by stomach acid, because the drug will not pass through the stomach when it's administered by the sublingual route. Instead, it will be absorbed direct into the systemic circulation. But this route also has some of the disadvantages, and these disadvantages are: first one, there is limited to certain types of drugs. This route of drug administration is limited to certain types of drugs. Not all drugs will be administered through this sublingual route. Especially here we need the drugs which are highly lipid soluble in order to reach the systemic circulation fast. And also one of the advantages is that it may lose part of the drug if swallowed. Suppose you put the drug under the tongue. When we say sublingual, means under the tongue. So if you put the drug under the tongue, or you may find sometimes you swallow the one of the part of the drug, and this will be one of the disadvantages. And also let's look about the another route of drug administration, that is rectal route. Oh, I found that I put there and there. Okay, let's discuss about this one. Rectal route, it means you administer the drug by using the rectum, and this way it has advantages and disadvantages. One of the advantages that is ideal if the drug causes vomiting. Suppose the drug is highly causing vomiting to a patient. So what is the way we will use to administer such drug? So therefore we take the rectal route to administer the drug to the patient, and this way is ideal in patients who are comatose. For the patient who are at coma, we use this way because these people who are at coma, they are paralyzed and they can't even swallow anything, so we use this way. But this has disadvantages. One of it is that may irritate the rectal mucosa. When we are putting that drug to the rectum, you may find sometimes it cause irritation to the mucosa of the rectum, and this is so bad because it will be one of the cause of the bacterial infection if the mucosa is irritated or is inflamed. So we found that someone will be prone to the bacterias. And this is not a well accepted route. Why is not a well accepted route of using a rectal route? Because it will cause inflammation to the rectal mucosa, and is not the fastest way of drug administration. The drug will reach the systemic circulation so slowly. Okay, let's go again forward. Okay, now we look about the inhalational route. Inhalational route. The term inhalation means inspiring in air. So it means that there are in the inhalational route there is the involvement of the lungs. During drug administration, lungs serve as an effective route of drug administration. It serves as an effective route of drug administration. And why? This is because we have pulmonal alveoli in the lung, which have large surface area and a minimal barrier to diffusion. So this will make the lungs effective effective route of drug administration. Another factor is because lungs also receive the total cardiac output as a blood flow. We have pulmonary circulation by which the blood goes to the lungs. So this serves as one of the important factors that make the lungs to be effective route of drug administration. Thus, and if we see that the total cardiac output as a blood flow go to the lungs, that the absorption from the lungs can be very rapid and complete because the blood flow there. What are the limitations of this route? One of the limitations of the inhalation route is that the drug must be non-irritating, must not cause irritation to a patient, and the drug must be in gaseous or very fine aerosols. Okay. But on our using this inhalation route, the intended effect may be systemic or may be local. Or when we are using the inhalation route, we have the intention to induce systemic effect or local effect. Suppose for the systemic effect, it means the whole body effect. So when we apply some of the anesthesia agent or anesthetic agent, like general anesthetics for the whole body, so we use this way. And maybe local. Suppose when there are patients with bronchial asthma, use these bronchodilators for the treatment of asthma. So this causes the local effect. And let's see the pictures that follow. This one illustrates about the inhalation route. The way that we administer drug by inhaling means inspiring air in. You see. Okay, let's continue. There is another route again, which is parenteral route. Parenteral route is you see there is a word enteral route and there is a word parenteral route. Pa means far, it means another side. So this is not we not use an enteral route. It means we use another route than an enteral route. So than another an enteral route. So parenteral route, it means we administer drug by using another route than the GIT system, and this composes a balanced route by where we have intramuscular routes. We inject the drug to the muscles. We have intravenous routes, we have subcutaneous routes, we have intradermal route. These are the routes that are together they form the parenteral route. And let's look one of the routes that is intravenous route. Intravenous means you inject the drug to direct to the systemic circulation. Okay. And one of the advantages of intravenous route, there is no absorption of drugs here because we inject the drug complete to the systemic circulation, and therefore we found out the drug will have bioavailability of 100%. Advantages: it has immediate effects because we inject when we inject drug using this route, the whole drug is injected into the systemic circulation, and there will be no time for absorption, and there is no lag time here. So this will be a way that produces immediate effect, and we use it in emergency situations. But this way also have disadvantages. Suppose you inject a bolus injection, which will result in adverse effect. And if you inject a bolus injection here, you can't withdraw. If you already injected the drug in this route, you can't withdraw it, and there is no way to control it. There will be no way to control because it already is in the systemic circulation, so it will cause adverse effects. And you need to strictly apply aseptic techniques to avoid the introduction of other microbiota in the blood when you are using this intravenous route. Okay, let's go. There is another route of drug administration that we call it topical routes. This involves application of the drug primarily to elicit the local effect at the site of application. It means here we apply our drug directly to the site of effect, and therefore we apply this route in order to avoid the systemic effect. For example, when there are some drugs that we administer to the eye, to the ear, to the nasal mucosa or skin. As you see in this photo, someone is applying a drug on the skin, and this illustrates the topical way of drug administration, by which we apply direct on the site or on the intended site. And in these routes, the drugs are generally formulated to be less lipophilic to reduce systemic absorption. They have low lipid solubility, so that they can't be absorbed to go into the systemic circulation. There is another route that we call intrathecal route. This is a way of drug administration by which there is a penetration of the subarachnoid space in order to allow access of the drug to the cerebrospinal fluid of the spinal cord. As you know, guys, there are some of the drugs that have low lipid solubility, and therefore they can't cross the blood-brain barrier, or they can't cross the blood the barrier that is between the spinal cord and the blood. So it will be difficult for this drug to reach the cerebrospinal fluid in order to produce the central nervous system effect. So what we do, we use this intrathecal route in order to penetrate the subarachnoid space direct, and then administer this drug in order to access the cerebrospinal fluid. Intrathecal route is used to produce spinal anesthesia. Suppose we are producing spinal anesthesia, and also in pain management, and in select cases to administer cancer therapy, we use this way. Look about the photo that for this one. Someone is trying to access the cerebrospinal fluid, and there is another route that we call vaginal routes. This is applied to women, and this is so suitable for pessaries. But this is one of the limitations of this route, is that the absorption of drug is generally slow. There are another route like intra-arterial route, by which you apply the drug directly to the artery. We have intra-osseous route. Osseous means the bone. It means the application of the drug is direct to the bone. Suppose we want to, our intention is to reach to the bone marrow. So what we use is the intra-osseous routes. So as you see, this is the needle is injected direct into the bone. And the other route is intra-articular routes. Articular means in the place of joint. So suppose someone has rheumatoid arthritis, so when we want to administer the drug, what way will we use? We use this intra-articular route in order to access the joint. As you see, this is the joint of the knee joint, and this is a needle. A doctor is trying to access this part in order to administer the drug. And another is intradermal route. The intradermal route is a most common useful route that is used when we are trying to see if someone was infected with the tuberculosis. You administer the purified. You administer the purified protein, the purified protein derivatives intradermal. And then you look upon the effect, if there will occur an induration to that part that you administer the drug, or there will be no induration, in order to conclude that someone was was infected or was exposed to tuberculosis. So we use this route called the intradermal route. And then guys, thank you for listening, and to get more of our lectures, subscribe our channels and you will get our lectures, and which provide different concepts on different subjects. Thanks.